my name is Jordan. I'm going to be giving a SUBQ injection today. First thing I'm going to do is I'm going to check my doctor's orders, gather my supplies, wash my hands, and check for any allergies that the patient has. I'm going to be following the 6 rights of medication administration, which are right dose, documentation, drug, patient, route, and time. I'm also going to check the MAR 3 different times during this process. I'm going to check the MAR whenever I'm drawing out the drug from storage, when I'm preparing the drug, and when I'm at bedside, I'm going to check it again. I'm also going to check the expiration date on here. Expiration date is 12/2018. And since I'm going to be giving a SUBQ injection, the gauges are 23, 25, 26. The lengths of the needle are 3/8, 5/8, and 1/2. Now I'm going to prepare my medication. And we don't need to wear gloves. I'm going to clean the top of the vial. And since I'm going to be drawing up 0.3 milliliters of medication, I first need to inject 0.3 milliliters of air into the vial. Draw this up and make sure there's no air bubbles in it. Now I can recap this. I just need to make sure I don't touch the table and contaminate the needle. Okay. Now I'm going to transfer all my materials to the bedside of the patient. When I get into the patient's room, I'm going to wash my hands, put gloves on, introduce myself and explain the procedure. I'm going to identify the patient with 2 identifiers, and I'm going to ask their allergies and make sure I'm not giving them a medication that they're allergic to. And places that you can give a SUBQ injection, there's 5 of them. It would be the love handles, the back of the upper arm, 2 inches from the belly button on the abdomen, the upper outer thigh, and the top of the glute. Okay, on a SUBQ injection, you want to grab 1 inch of fat, and that's where you're going to inject it. And I don't want to inject this, so So grab that inch fold, and you're going to inject this at a 45 to 90 degree angle. And before you inject this, you need to check the assessment. So that would be vital signs and all that. And you want to check that before and after you get this. Inject it in like a dart-like motion, and then inject the medication slowly. Pull out, and you don't need to rub this. Do not recap the needle, and throw both of them in the hazard container, and that's a SUBQ injection.